Welcome to the Deep Dive. We're here to unpack the sources you shared with us.
That's right.
And today, we're plunging into something huge, healthcare. Specifically, how technology, particularly artificial intelligence, looks set to transform healthcare in India.
And crucially, the role government initiatives are playing in, well, making that happen.
Exactly. We've got a good set of sources here, a broad look at AI in healthcare, plus specifics on a key government initiative.
Yeah, it seems quite comprehensive.
So our mission is to pull out the key insights. We want to understand AI's potential, the unique challenges in India, and really focus on how initiatives like the Ayushman Bharat Digital Mission, ABDM, are kind of paving the way.
Building that digital foundation so AI can actually take root and grow.
Precisely. And the sources jump right in with ABHA, the Ayushman Bharat Health Accounts, part of ABDM.
Right, and they highlight its role in efficiency and transparency, making things clearer.
Yes, like using real-time monitoring for fund use, making sure resources go where they should, preventing misuse. It's about visibility.
And that builds trust, right? Accountability, digital transactions, electronic records through ABHA. The idea is it reduces the space for, well, corruption.
Building a cleaner system. Okay, so let's step back. Why is this transformation so needed? The sources paint a pretty clear picture of the problem.
Oh, they do. Think about it from the patient side first. We've all been there or know someone like the Mrs. Sharma example they used, just struggling to book a follow-up. Access is limited. Admin is a nightmare.
It's incredibly frustrating. And then for doctors, the Dr. Patel example, the oncologist.
Drowning in information. Patient histories, labs, scans, new research popping up constantly. It's overload.
Which isn't just stressful, it increases the risk of errors, right?
Yeah.
Missing something crucial.
Exactly. So that sets the stage for the core idea in your sources. What if technology, specifically AI, could help? Could it streamline things, boost human skills, improve outcomes, make the whole system work better?
That's the big question. Which brings us to the tools themselves. AI, machine learning, LLMs. The sources try to break these down.
Yeah, they keep it fairly simple. Traditional AI. Think rule-based, like a very strict flowchart. If X happens, do Y. Predictable, but brittle. It breaks if something unexpected happens.
Okay, so not great for messy, real-world healthcare. What about machine learning, ML?
That's different. It learns from data, complex data, noisy data. It finds patterns, adapts, can even automate decisions based on what it learns. Much more flexible.
Right. And then large language models, LLMs. The sources mentioned these are often used in wrapper applications.
Wrapper applications, yeah. Tell us more about that. What does that actually mean here?
Think of it like putting a smart layer around existing information or processes.
Okay.
They use AI, often LLMs because they're good with language, to make that underlying stuff easier to use or understand without needing to rip everything out and start over.
Ah, okay. So it's enhancing what's already there, making it more accessible.
Precisely. And this is where the sources get really practical, listing lots of potential uses in India.
And many of these wrapper examples sound incredibly useful day to day, like a prescription analysis tool.
Yes. Imagine scanning your doctor's confusing prescription, handwritten maybe, or just jargon filled with your phone.
Right.
The app uses tech like OCR, optical character recognition, to read it, sends the text to an LLM, and boom, you get a simple explanation on your phone. What the drug is, why you take it, how.
That could massively help people actually take their meds correctly, reduce errors, tackle that patient frustration we talked about.
Totally. And similarly, a lab report interpreter, taking dense results.
Yeah, those PDFs full of numbers and acronyms.
And getting a plain language summary via an app. Understanding your results helps with early detection, makes you more likely to follow up.
Makes sense. And discharge instructions. Critical information, often complex, maybe not even in your first language.
Oh, absolutely.
An LLM tool could simplify and personalize those. And for India, this is vital multi-language support, cultural awareness, making it accessible for different literacy levels. Better understanding means better recovery, maybe fewer readmissions.
Fewer people ending up back in the hospital unnecessarily. And for the doctors and nurses, medical documentation summarization.
Yes, huge time saver. AI summarizing long patient histories, notes, research articles directly helps with that information overload problem for Dr. Patel.
Frees them up for actual patient care. Improves decision-making, maybe, by highlighting key points.
Potentially, yes. But, and this is crucial, it needs seamless integration with existing systems. HIS, EMR.
You mentioned those acronyms, HIS and EMR. Quick reminder.
Sure. HEYS is Hospital Information System, handles admin, financial, clinical stuff. EMR is electronic medical record, the digital patient chart.
Got it.
AI tools need to talk to these, and LIS for labs, KCS for radiology images. Integration is key, and data security, obviously, is non-negotiable.
Okay, so beyond these wrappers, AI can also help optimize how hospitals actually run. Resources, flow.
Yes, patient flow optimization is a good example. AI analyses arrival patterns, how long things take, where resources are.
To spot bottlenecks.
Exactly. And predict future flow, adjust staffing or rooms in real time, cut down those frustrating waits, improve the whole experience.
In bed management. Always a headache in hospitals.
Right. AI predicting bed availability based on who's coming in, who's likely to leave, typical stays. It helps allocate beds more efficiently, use them better. Then you get into clinical workflows.
Yeah.
In the OPD, the outpatient department, automated patient triage.
So guiding patients based on symptoms.
For non-critical cases, yeah. Input symptoms, AI suggests the right direction, reduces nurse workload up front, ensures consistency.
And voice-to-text documentation. Seems simple, but could be huge.
Definitely. Doctors speaking notes directly into the EMR instead of typing. Saves so much time for patients. Plus, maybe more accurate notes captured right in the moment.
Okay. And in the wards, fall risk assessment.
Yeah, using real-time data, maybe sensors, maybe just EHR, data-trained AI models predict who's likely to fall. Alert staff proactively.
And the source mentioned a Mumbai example.
A 30% reduction in fall injuries. That's a real impact on patient safety. Using tech effectively.
Wow. And even more critical, clinical deterioration early warning systems.
These watch vital signs, other data, constantly. AI looks for subtle patterns that predict a patient might get seriously worse.
Allowing doctors to step in earlier.
Exactly. Early intervention saves lives. The Bangalore example in your sources, 25% fewer unplanned ICU transfers, 15% lower mortality. That's significant.
Truly life-saving potential there. And diagnostics, too. AI reading scans.
Automated nodule detection on chest x-rays, for instance. AI flags suspicious spots for the radiologist, like a second check, reducing misses.
And in pathology, counting cells.
Automated mitosis counting, yeah. For tumor grading. AI does the initial count on digital slides, pathologist verifies. Faster, potentially more consistent.
And even after discharge, keeping tabs on patients remotely.
Remote patient monitoring analytics. AI interprets data trends from home devices, blood pressure cuffs, glucose monitors to spot early signs of trouble, reduce readmissions.
And maybe a virtual nursing assistant. Using NLP natural language processing.
Right. Handling common patient questions via chat or voice. Frees up nurses, escalates complex issues to a human.
Patient-facing app personalization is also in there, making hospital apps more engaging.
Yeah, tailoring content or reminders based on the user's data, nudging them towards adherence follow-ups.
So the potential use cases are, well, vast. But the sources are quite grounded about the challenges, especially in India.
Very much so. Implementation isn't easy. Data is the big one.
Always data. Availability, quality, standardization, making it usable.
And cleaning it.
Yeah.
Plus adhering to all the rules, IT Act, the Data Protection Act, health regulations like DSHA potentially. Standardized quality data is the fuel for AI.
Without it, the models just sputter. Infrastructure, too.
Key challenge. Cloud is great, but what about rural areas with patchy internet? Systems need to work offline or with low bandwidth.
Can't assume everyone has perfect connectivity. Cost, obviously, is huge.
Needs to be cost-effective. Phased adoption makes sense. Start small, prove value.
And getting people to actually use it. User adoption, training.
Crucial. Training healthcare staff. Addressing different levels of digital literacy for both staff and patients.
And language.
Yeah.
And culture. Especially for patient tools.
Absolutely vital in India. Multi-language support is a must-have, and cultural sensitivity in how information is presented.
Integration, again, making sure AI talks to the EMR, HCIS, LAS, PACS hands.
Non-negotiable. It can't be a standalone gadget. It needs to be part of the workflow via APIs.
And finally, partnerships. Working with local groups, manufacturers, telcos.
Yeah, building that local ecosystem is important for sustainability and relevance.
So lots of practical hurdles. And then there are the ethical dimensions. Your sources stress these heavily.
As they should. Data privacy and security are top of the list. Protecting patient data is paramount. Encryption, access controls, anonymization where possible, following all the laws.
No cutting corners there. Algorithmic bias is another worry.
Huge concern. If your training data is skewed, maybe it underrepresents certain groups, the AI can perpetuate those biases, leading to unequal care. Need diverse, representative data.
Fairness by design. What about jobs? People worry AI will replace them.
The focus needs to be augmentation, not replacement, making professionals better at their jobs, more efficient, and providing training so people can adapt to working with AI.
So it's a tool, not a substitute.
And that leads to human oversight. AI assists, it doesn't decide. Clinical judgment remains with the human professional. Explainable AI, XAI, helps build trust, letting us see why the AI suggests something.
Right. AI is an aid, not the final word. Okay, so bringing this all back home, how do government initiatives like ABDM weave into all this?
This is really the connecting thread. ABDM is about creating the digital health ecosystem. It's building the infrastructure.
Like the digital highways and the rules of the road we mentioned earlier.
Exactly. Promoting data standards, secure exchange through things like ABHA, setting guidelines. It lays the foundation.
So ABHA's transparency features aren't just about money. They build trust in the digital system itself.
Precisely. That trust, plus the standardized data frameworks, the push for systems to talk to each other, interoperability, that's what AI needs to actually work across the country.
It provides the plumbing, the rails for the AI train to run on.
You got it. You can have amazing AI, but without good data, secure ways to share it, integration into workflows, it stays theoretical. ABDM aims to build that enabling environment.
Wow. Okay, so the potential for AI to really change Indian healthcare seems immense. Efficiency, safety, diagnostics, outcomes.
It's huge. But as your sources show, getting there means tackling those implementation challenges head-on, wrestling with the ethics, and doing it all within the framework these government initiatives are trying to build.
It's not just about the tech itself. So here's a final thought for you, our listener, to chew on. As India builds this digital health future with all these initiatives and technologies, what do you think is the single most critical thing needed to make sure this transformation genuinely benefits everyone from Mrs. Sharma in the city to someone needing care in the most remote village?